So we have a very exciting case today. We have a very nice lady who's traveled from another state to ours after having completed a very brave and impressive weight loss journey. She's lost close to 120 pounds and she's continuing to lose more. She still has lipodystrophy around her waistline, but she has a lot of skin to the point that occasionally she gets rashes and infections in the bottom part of her abdomen. So we've decided to proceed with a staged approach. One of the things that I always try to remind my patients who've lost usually greater than 80 pounds is that many times to address everything that they need, we may have to devise a two-surgery approach. Instead of trying to do 4 or 5 things all at once, their body is going to basically benefit more if we did little by little in 2 different procedures, because we know that somebody who's had gastric bypass surgery usually doesn't have the same healing potential than somebody who has not had that surgery. So in this case, today we're going to address her main concern, which is improvement around the waistline. We're going to be doing a circumferential body lift, which some people know as belt lipectomy. It's essentially an incision that goes all around the waistline, allows us to remove extra skin pretty much in the front, in the sides, and in the back. And by the same time, we're actually lifting the buttock when buttock has now become a little bit droopy through weight loss. By the same token, we're also going to be doing a vertical incision or a vertical component in the front. Some people know that as the fleur-de-lis tummy tuck. Reason is because she has a lot of laxity and extra tissue on the side-to-side direction. So that will allow us to really slim the waistline. Because we know that when we lift her buttock, the buttock is going to look a little bit flatter. We're going to be doing a BBL at the same time. So we're going to be taking fat from all around her waist, and we're going to be preparing that fat and putting it into the buttock to give her more fullness. In the second surgery, which is going to be done in about 6 months, we're then going to address her breast, her arms, and her upper back. Usually down the road, if she wanted, she could then get something for her thighs or for her face. Facelift is something that also becomes important to people who've lost usually greater than 120 pounds. So stay tuned.